What is up, everyone? Welcome back to another episode of Integrative You Radio. You got Dr. Nicole flying solo today. Primarily, it's been a very crazy few weeks, and Dr. Nick and I's schedule has not aligned. So here we are, but you get the real and raw of me talking about one of my favorite topics, which is parasites. So here we go, my friends. But this is going to be a bit of a spin on some of the things that we've talked about in the past. And it's primarily because I think there is a lot of confusion around the root cause of hemorrhoids and what the symptoms actually look like if you truly have hemorrhoids and Crohn's disease and ulcerative colitis. Because again, there is a lot of mixed information when it comes to what exactly the symptoms look like with Crohn's and ulcerative colitis and what is the actual root cause. And what I'm bringing to you today is a theme that I have seen over and over in the past decade of my career. This is definitely not the only thing that plays a role in someone having an inflammatory bowel condition like Crohn's or ulcerative colitis, but it is something to be investigated. So I want to preface there is that I'm not telling you that this is 100% what's going on. I'm telling you that it's a possibility and it is time for you to possibly investigate if that is your root cause, especially if you have embarked on different therapies that are not working. And I'm not necessarily talking solely about conventional medicine because conventional medicine's approach to inflammatory bowel conditions, autoimmune inflammatory bowel conditions like Crohn's and ulcerative colitis, is usually immunosuppressants, either through pill or infusion. If you shut down the immune system, you give any infection or pathogen the opportunity to multiply and not necessarily just stay in your gut, but actually move to other parts of your body that are vulnerable tissues. So that's a whole topic in itself. But even if you have embarked on going the functional medicine route, what I find in this industry is that there are certain functional medicine doctors that have a tendency to be a bit more of an expert in certain things. And when they have more of that focus, they will tend to treat for certain things that might not be foundational for that person. Meaning, if there is a practitioner that is classified as the functional medicine mold doctor, expert in mold, treats many mold cases, they might say, oh, well, you definitely have a mold issue, which most people have mycotoxins in their gut because of the absolute shit garbage food that's being fed to us in the USA. But that doesn't mean that that's the foundational issue. You have to understand is that you can get testing back and it says, oh, you have mold and you have parasites and you have heavy metals in your gut, but there's still a hierarchy. It's not that they're all doing the same, causing the same amount of problems at an equal magnitude of stress. There's going to be one that's more foundational to the others, and you have to get rid of that more foundational issue before you're going to be successful with getting rid of the others. So, because of the nature of how a parasite works, it's usually the more foundational issue if it's part of your puzzle. So, we're going to talk more about that, but I want to kind of backpedal here a little bit. So, when someone is suspecting or know that they have Crohn's or ulcerative colitis, there is usually blood in the stool. And it's usually one of the reasons why you seek out the testing, which then finally determines that you have Crohn's or ulcerative colitis. Some people obviously it's stomach pain, stomach cramping, and then a lot of people that I have worked with personally have said, I had blood in the stool and I was really scared. And that, took them down the road of investigating what the heck is going on here. But, they ended up with the diagnosis, which is really just a description of the symptoms without really understanding the root cause. This is just, unfortunately, the way conventional medicine works. And some of the other things that a lot of these individuals experience, in addition to blood in the stool, stomach pain, stomach aches, food intolerances, is losing weight, getting thin, and even muscle wasting. And so they're then told, oh, well, it's because your digestive system is compromised and you can't absorb nutrients and you're essentially malnourished. Uh, Half truth is essentially everything that I just described is essentially a half truth. So going back to this idea of hemorrhoids versus, something more inflammatory bowel related. When it comes to hemorrhoids, what hemorrhoids actually are, I think is important because it will ease your mind a bit. Because of course, anytime you see blood coming out of your body, it's scary. But if you see a very bright colored blood coming out, and if it's coming out in droplets or it's even floating a bit in the toilet water, or you wipe and there's some bright red blood on the toilet paper, that's usually going to be a sign of hemorrhoids. And hemorrhoids are when the veins of the rectum become inflamed. So, can parasites in your gut, Crohn's disease create inflammation in your rectal veins? Of course, especially if you're having trouble going to the bathroom and you tend to have a lot of downward pressure to try to push, push, push to get those bowel movements out. Yes, that can definitely play a role. But the other factor that I think goes not unnoticed, but it's just not necessarily taking a deep dive into it is that when you have blood in the stool and it is that bright red blood either on the toilet paper or in the toilet water, that is usually going to be hemorrhoids. And hemorrhoids being vascular can actually be correlated to different toxins or infections that are inside of the vascular system that could be coming from your reproductive organs or your urinary system. Because the vascular complex and the lymphatic complex of your pelvic bowl is actually very much connected to the rectal veins. So, some people have run ins with sexually transmitted diseases. Some women have bacterial vaginosis or yeast infections, reoccurring urinary tract infections. And these things can make their way, get picked up by the capillaries and get into the bloodstream, create an inflammation in the lymph nodes of the pelvic bowl, which usually causes people to, hold weight in their legs and their thighs, have water retention in their legs, cankles, etc. And so the other thing, though, about what can be in the rectal veins coming from the reproductive organs or the urinary tract can also be chemical toxicities. I was actually just doing a report for one of my clients, and she had asbestos coming up in her system, but it was actually coming up in her vascular complex of her pelvic bowl. And it turned out that for 40 years, she used Johnson and Johnson talc powder, like baby powder, which has now been taken to court because it had asbestos in it and a variety of other chemical toxicities. When you get into tampons and lubricants and condoms and all of that, those also have a tremendous amount of toxins in them. So, the moral of the story is that if you have what we described as this bright red blood that's coming out, it could have nothing to do with Crohn's, have nothing to do with ulcerative colitis or any other type of inflammatory bowel condition. It could solely be because you have inflammation in the veins, and that inflammation in the veins can be from pressure, which can actually go back to you have pressure because all the lymph nodes in your pelvic bowl are clogged because of the toxins or infections that are coming from your urinary system or your reproductive system. So it takes a deeper dive to really understand what the heck is going on there. And yes, of course, things like pregnancy can be a contributing factor because of all the downward pressure. But if you developed hemorrhoids through your pregnancy and it truly was just correlated to the pressure from the baby, the placenta, the amniotic fluid, etc., they should go away after the baby is out of the body. It should, it could take a month, 2 months. But if they don't resolve, it's actually telling you that there were underlying issues and a low level of inflammation already in those veins of the rectum, and the pressure from the pregnancy then was the straw that broke the camel's back, essentially. So it's a feedback mechanism to say, figure out what's going on here. So now let's really get into this idea of Crohn's, ulcerative colitis, blood in the stool, getting thin, muscle wasting, and parasites. Because we're not talking about all parasites. We're talking about a very, very specific type of parasite called hookworm. Oh God, if you want to Google it, you'll be fucking horrified. It is like the nastiest, ugliest, scariest looking parasite. Obviously, it doesn't look like this when it comes out of your body. If you're doing a detox, it looks like this under a microscope. So, but there's some pretty intense pictures online. But the interesting thing about hookworm is it hooks into the intestines because it has teeth essentially. So it can hook itself by biting down onto certain tissue, which can create ulcerations or internal wounds. What is Crohn's disease, guys? Crohn's is patches of ulcerations throughout different parts of the intestines. The difference with Crohn's is that it could be in your esophagus, it could be stomach, small intestine, colon. Ulcerative colitis is itis is inflammation, colon, colitis. So it's telling us that everything is primarily in the colon. Crohn's is just telling us it could be in other parts of the digestive system. So, same, guys. It's inflammatory issues with ulcerations throughout different parts of the intestines. And so, the nature of this type of parasite is it literally can hook itself by biting down, creating these puncture wounds, if you want to call it that. And it also feeds on blood. So one of my clients, he was like completely horrified, and he was almost like a little I don't want to say upset, but he was kind of like, gosh, like I'm doing this protocol and I don't like I don't know, why is this still happening? Like I'm still having so much blood. And he's like, but it looks so different, and it's like these clumps, it's scary. And I asked, next time it happens, I need you to send me a picture of it. And essentially, he sent me a picture of what looked um like a blood bubble. It was a tissue filled with blood. But it turned out he was passing hookworm that was filled with blood. So this is something that if you don't know what you're looking at, you don't have someone helping you, you don't have someone who's there to probe and to help you understand what's happening. He was looking at it, this is bad. Oh my gosh, what's happening? And I'm like, this is perfect. You're actually finally getting rid of the hookworm that is filled up with blood, and your body is passing this and getting rid of it once and for all based off of everything you're doing to heal your body.
All right, guys, we had a little intermission there, that whole like the whole work from home life has its perks, but then when you have small humans running around that don't understand the concept of work, totally different story. So anyway, here we are. We're gonna do a quick little recap and then piece this together with the other point that I was driving home, which is in relation to losing weight, losing muscle, protein wasting, etc. So one of the primary things that we'll be told is that throughout the time frame of having Crohn's, that it would be part of your diagnosis that you can become anemic, that you can lose weight, that you can start to have lack of certain vitamins and minerals because of malnourishment. But we have two major things that we need to think about here. One is you have a parasite that is consuming what you're consuming. It is also consuming blood. This is going to decrease blood volume. It is also going to decrease your iron concentrations, which is then going to make you bruise easily. It's going to take away pigment. It's going to make you look pale. It's going to make you look unwell. And then when it comes to the other factor of protein loss, is that this protein loss is partly because your kidneys are the filters of your blood. So if you have a blood consuming parasite, there is a probability that some of these parasites will go into the vascular system and the kidneys will try to filter it out. Even regardless of that, you're going to have some level of toxins that come from parasites. This is a very common thing that there will be certain toxins given off by parasites. It's like a byproduct. Those toxins are going to have to get filtered through the kidneys. And so you'll have a tendency to start losing protein because your kidneys are becoming compromised, which is going to cause you to lose muscle mass and also lose weight. In some cases, I've even seen people being diagnosed with rhabdomyolysis, which is a rapid loss of muscle. So there's a lot of different things here that are happening. There's a lot of opportunity for different diagnoses. Diagnoses from, oh, you have iron deficiency, oh, you have Crohn's disease, oh, you have ulcerative colitis, oh, you have GERD, and and you have hemorrhoids. But it's actually one, it could be all connected, and two, is that there's a foundational reason why it's happening. And as I've mentioned, is that I'm not telling you that hookworm is the only cause of Crohn's or ulcerative colitis, but I am telling you that it is worth it to investigate if that is the foundational reason why you have that condition in the first place, especially if you have been told that you're iron deficient or malnourished, or you tend to be on the thinner frame even though you eat a reasonable amount of calories. So, big difference between seeing bright red blood in the stool, or I'm sorry, bright red blood on the toilet paper or in the toilet. That could be a sign of hemorrhoids. Hemorrhoids could be associated with inflammatory bowel conditions, but it can also be associated with certain toxins that are in the lymphatic system and the vascular system of the pelvic bowl that are linked back to your reproductive organs or linked back to your urinary system. I also mentioned that with pregnancy, if pregnancy induced hemorrhoids and it's solely due to the weight of the baby or the downward pressure from the baby, they should go away after the birth of the baby. If they do not go away, there might be something more foundational going on. If you have blood in your stool and maybe that blood is dispersed throughout the actual bowel movement, you see little specks of blood, you see like little tiny clumps of blood, you see mucousy blood, or you're even passing things that look like tissue. They look like almost like a balloon of blood. Those can all be signs that you have hookworm in your system. And maybe you don't have the diagnosis of Crohn's or ulcerative colitis, but you have stomach aches and you have stomach pain and you have stomach cramping and you have weird fucking bowel movements. All the same shit. So, very, very important for you to understand these different things so you feel empowered in the process of knowing how to ask the right questions, how to seek out the right doctors, and also that you need a different set of testing in order to really decipher, is this going on for you? So, the question you might be posing in your brain is, should I get a stool test? So, had this conversation just yesterday with a client, and she's like, do you think it would be valuable for me to do it? I'm like, well, there, any type of stool sample that I've ever experienced through your conventional labs that are in network with your insurance, LabCorp Quest, they are not valuable. There's a lot of other labs that are offering private labs that are offering testing for parasites. I do use private labs like Vibrant America and DNA Connections, and they do really, really great things. But the problem that exists with parasites, and this is not talking poorly on any labs by any means, it's really just the nature of how parasites exist in nature. It's a lot of times when you go to a vet, if you have a dog or a cat, what they're going to do is they're going to either do a swab and get some fecal particles and then go put that under a microscope to see if there's parasites, or they're going to try to get a stool sample, and within the time frame of getting that stool sample, within, you know 10, 15, 20 minutes, they're going to go put that under a microscope and examine it for parasites. But the problem with human specimen is that they're asking you to do at home samples. So you might do a day, 2 days, 3 days. You have to do more than one day to really even possibly see if you have parasites. But regardless, once a bowel movement leaves your body, and if that bowel movement has parasites in it, most parasite, not most, all parasites are going to start to autolyse, break down after they've exited their host. So they start to break down within about a half an hour. So if your sample is sitting, then getting shipped off to a lab, and now we're talking weeks later, it's finally getting processed. Very often they're going to say no parasites because they have been broken down and what we call autolysed, and they are unrecognizable through the testing because they're not live parasites anymore. So I don't always recommend stool samples for that reason. I am very conscious of making sure that we're using money wisely in the testing process. So I often will run a variety of different blood and urine labs that will help us decipher, is the body reacting to parasites through different markers? And then we also leverage our DNA testing to decipher, is the DNA of certain worms inside of the body, inside of the gut, inside of the kidneys, inside of any part of the body. So our approach is a little bit unique, but it gives us good information that allows us to then customize what we're doing and the protocol that we're leveraging in order to start eradicating the parasites out. And the beauty of it is I get pictures of my clients passing these parasites out of their body. And that's the most important thing, is knowing that what we're doing is actually working. All right, guys. Well, I hope this was insightful, empowering. I really want to just take a moment to say I know Crohn's and ulcerative colitis are terrible conditions. They affect people's quality of life. And I know that a lot of people go through, it's like a psychological warfare, thinking I'm going to have to live with this for the rest of my life. But I do want to tell you, you don't have to, as long as you can figure out what the root cause is. And now with this information, you can take it a step further to investigate, is hookworm part of the puzzle for you? And what can you do about it?